Hi, I'm Mike Gilliam, and welcome to Talking Health. Over the next half hour, we'll take a look at medicine in the United States and the many ways medical practices are changing. The field is certainly a lot different now than it was 50 years ago. Back then, just about everyone had a family doctor, and if you didn't move to another city, you often saw only that doctor for a good portion of your life. Now, instead of having a family physician, many go to the hospital emergency room when they are ill, or they seek medical care through other facilities. There are HMOs, clinics, and urgent care facilities in many neighborhoods. The landscape has changed, and it will continue to change. There are challenges for physicians and healthcare providers. Joining us to discuss the trends and give us a feel for where this is all going is an expert in the field, Dr. Anthony Shih, the Executive Vice President of the New York Academy of Medicine. Board certified in preventive medicine and public health, Dr. Shih is a physician executive who is nationally recognized for his expertise in healthcare policy. Dr. Shih, welcome.
Thank you. It's a pleasure to be here.
Good to have you. How is the practice of medicine changing?
Well, I think to understand the answer to the question, I think it's first important to look at the broader context under which change is occurring. First of all, I think there's an ever-increasing pressure on the healthcare delivery system to manage not only quality, but also costs and resources. You know, in the United States, we spend more than any other industrialized country in the world on healthcare, on average twice as much per capita and 50% more as a percent of GDP. And for that, as a health system as a whole, we're only getting average patient outcomes.
So we're not really getting the bang for the buck.
Yeah, and this is despite having some of the best medical centers in the world. It's just on average as a whole, we're not getting the value that we should be getting for that much money. Secondly, there is this rapid proliferation of medical knowledge. Not only knowledge from scientific advances, but we're now starting to collect a lot of data on both patients, providers, and their interaction. And finally, there is, like every other sector, technology is having a profound impact on the practice of medicine. So all these three forces are driving physicians into different and new care delivery models that can react to and take advantage of these trends.
Mm-hmm. Let's talk about those models.
Yeah. I think two of the models that are gaining the most traction right now is the patient-centered medical home and the accountable care organization. The patient-centered medical home is an approach to providing primary care that is both comprehensive and coordinated and leverages technology and team-based care to provide the best care for patients with a focus on prevention and managing chronic disease. And the thought there is that if you do that well, then you can prevent complications and costly hospitalizations down the line.
And kind of give me an example for how that would work for a patient.
So a patient would have a single place where they can go to that would provide comprehensive coordinated care and help manage all the health care for that patient. And an important part of a medical home is also being open and accessible, so being available after hours and offering same-day appointments. The second model that's getting a lot of traction is the accountable care organization, and that takes the concept one step further. So it's larger groups of providers, both primary care and specialty care and hospitals and other settings, coming together and taking accountability for the quality and cost of an entire patient population, also leveraging teams, care coordination, technology to achieve their aims.
Give me kind of a hypothetical example of what you mean when you're talking about these different organizations.
Yeah, so we might have a large physician group that has primary care practices and specialists entering into an agreement with a hospital or several hospitals, and then entering into an agreement with a payer such as Medicare and saying we're going to take care of 10,000 of these patients and we want to be judged on both the quality and costs of care that we provide.
And that's a big change in medicine, right?
That is a very big change in medicine, and we see that more and more in the last few years and moving forward.
Now, does that in fact make a doctor more accountable for his patient's outcomes?
Yes, it does. But you know, it's very hard for an individual doctor to do this, and this is why doctors are getting into more and more larger groups and larger organizations. It's also important to mention that all these changes in the delivery system cannot occur without changes in the payment system. So we're moving away from our traditional fee-for-service payment system where providers get paid for each medical intervention or test or visit that they do into a system that rewards overall health of a patient. And what that does is allows the providers to be more innovative in terms of the things that they do to promote health.
Now, is that changing what goes on in emergency rooms as far as who's going there and that sort of thing?
Well, the hope is that when you have this greater organization and better coordinated care, that fewer and fewer emergency room visits would need to occur because you're avoiding some of these complications from chronic diseases.
Okay. The Affordable Care Act, it's played a real role in the changes in medicine, and that's actually because it's more than just an insurance program, right?
That's exactly right. About half of it was about expanding coverage, which was very important. The other half was about changing the delivery system, again, to provide higher value. So in addition to the Accountable Care Organization program, which is a new program under Medicare, the Affordable Care Act established the Innovation Center, which is testing new models of payment and delivery system change to provide higher value care.
One thing that we're seeing more and more of is urgent care facilities. Now, we went to one of those on the Upper West Side just to kind of take a look and see what exactly was going on inside an urgent care facility.
Okay.
Let's take a look at that.
Okay, great.
Cure Urgent Care is a brand new facility, and its founder and clinical director, Dr. Jake Deutsch, says it works for a number of reasons, not the least of which is economics. The clinic is for profit.
If you go to the hospital, your average bill is going to be about $800. Your average bill going to an urgent care is about $200. So right there, you could see a big discrepancy in the costs of going to receive medical treatment. Additionally, we take insurances. So for patients, there really isn't a big difference if you're insured because you're going to have access to treatment. But the insurers love to have us take care of their patients because our costs are so much lower.
And Deutsch says there are reasons for the lower costs.
We're a much more efficient model. We don't have the overhead of the hospital, the redundancy of the hospital. We don't have patients that are coming in and using fake identification and causing bills to be generated that are being unpaid. So our model's a lot leaner, it's a lot tighter, it makes more sense for the patients, it makes more sense for the insurers. So that's where this model, the urgent care practice, has become so popular.
Now, you guys don't take Medicaid though, right?
There is a difficult situation with that because they don't want us to see their patients. They have a particular setup with HMOs and their providers which their patients go to. And while we've reached out to them and tried to form some contracts, it's just not an option for us now.
So they won't work with you guys, is what you're saying?
No, we'll see anybody. But if you don't have insurance, then there's a cash fee associated with that. And unfortunately for people that are on assistance like Medicaid, their program doesn't allow them to go to urgent care centers.
One of the reasons more and more patients are opting to use urgent care facilities has to do with their hours of operation. They try to be more accessible.
We're open from 8 a.m. to 10 p.m. on the weekdays and 9 to 9 on the weekends. We're really about convenience factor. And in addition to being available and easy to get to, we are all about efficiency. So nobody should be here for more than an hour, no matter what the problem.
Deutsch says urgent care is based on exactly what people don't like about emergency room.
The business model is really a reaction to ER overcrowding, the long waits that people incur in the hospitals, and to some degree, patient dissatisfaction with the model that's set up by emergency departments.
The facility has an X-ray room on site, and all records are handled electronically.
We actually take the patient's information at the bedside electronically, so we're working with tablets so that information can be taken in immediately and put into the medical record. Of course, we have an electronic medical record, which is the standard nationally, but our electronic medical record is really nice that we can send reports to the patient's doctors, we can integrate the information from our x-rays. It really takes the patient experience to another level. Having technology at the bedside allows us not only to obtain information, but to teach. So we have patient information in terms of diagnoses and interactive information that we can bring to the patient at the bedside, which makes understanding their problem much easier for the patients.
In this clinic, iPads and computers play a big role.
With the electronic medical records, we're able to, input the data, grab it, enter it into the system, and if we needed to forward anything, everything's already there into the system. It's not something that, you have charts that you have to, save, and the doctors can also see it, like let's say they're at a different location, they can also pull up the information from wherever they are.
33-year-old Jonathan Jasinski visited the facility while undergoing treatment for a respiratory problem.
I came in, I had to get some cultures done. They took care of everything I needed that day, and then the next day I came back, I got cultures, then I called, and they had the results really fast. They did printouts for me, and they followed up with me. Actually, that's why I came in today, and they actually gave me another printout to finalizing all my results and everything. It was really good.
Deutsch says the facility is seeing an influx of patients who don't have primary care doctors, but now have insurance as a result of the Affordable Care Act. And he says there's a simple rule of thumb for whether or not an urgent care facility is the right choice for a patient.
So when you have a life-threatening problem like a heart attack, obviously you're going to the hospital to be treated in the ER. But when you have those non-emergent problems, the orthopedic injuries, lacerations, or even something like a sinus infection after hours, we're the place that you would go to get things taken care of quickly and efficiently.
Okay, Dr. Shih, he obviously believes in the urgent care facility, right?
Yeah.
But how do you feel urgent care facilities fit in the overall delivery of health care?
Well, urgent care centers provide easy, accessible care for patients for non-emergent conditions at a cost generally lower than emergency rooms. Clearly, there's a patient demand for these services as the number of centers has grown rapidly over the past few years, as well as the patient volume. On the upside, as an alternative to ER care, it's lower cost. The primary concern, though, is that it potentially disrupts continuity of care or coordination of care for patients who have chronic medical conditions.
What do you mean by that?
For patients with multiple medical conditions, what's desirable is to have a primary care physician or a primary care practice coordinate all their care. Now, if that patient is going to multiple different facilities to get care, then it makes it much more difficult to provide the right care at the right time for that patient.
Okay. Who should use an urgent care facility?
Well, again, I think if it's a condition that is non-emergent, and I think if it's for conditions such as a sprain or a cold, I think it's fine. But I think for the management of chronic medical conditions, you're probably better off going to your primary care provider.
We've talked a lot about some of the changes that are happening in medicine. How are they actually affecting physicians?
Well, I think when you opened the segment, you said that the practice of medicine is very different from 50 years ago. I think it's even very different from 20 years ago. They have to practice in this environment under this these broad policy changes that are going on, the increase in cost pressures, the technology, the growth of knowledge. It means they're practicing in different settings. For many physicians, it's practicing in larger groups, it's practicing in teams, and it's being comfortable with technology.
What about young doctors? How is it changing their careers and how they embark on their careers?
I think young doctors nowadays, almost all of them don't even think about opening up their own private practice anymore, hanging up their shingle. No, I think for most young docs, they think about being employed or being part of a large group or a large health system and practicing in this new environment. And part of it is that these larger health systems and these larger practices are able to provide the infrastructure, the technology, the knowledge management infrastructure to help deal with all these other pressures.
Does that make it a less desirable career?
No, I think medicine is as exciting as ever to be in. I think medical advances have allowed us to do so much more for patients. I still think it's a very good place to be.
Do you think there'll be a shortage, though, of physicians?
That's a very complicated question. I think there's a lot of factors to consider. First, the distribution of physicians in the United States is very uneven. So whether or not there's a shortage depends in part on where you live.
In other words, in large urban areas, you have more doctors, and in rural areas, you don't?
Yeah, that's true. But even within an urban area like New York City, on the Upper East Side, there are a lot of physicians. Deep into the South Bronx, there are fewer. So that's an issue. I think there can be debate on whether or not there's an absolute shortage of physicians. There's general agreement that we need more primary care compared to specialists. So in the US, we have this imbalance. We have not enough primary care and too many specialists. And then thirdly, I think as we think about these new care models, maybe we don't need the same number of physicians per population as we did in the past. Once we start leveraging technology or using more team-based care, one can foresee that we may need fewer physicians per, let's say, 1,000 patients.
You touched on something I wanted to go to, and that is the technology. We saw that in the piece that we just looked at. People are using iPads. There's a lot more technology involved in medical care now. Is it really changing medical care?
I think we're at the tipping point. You saw all the iPads and the electronic medical records, and that's just starting to manage the information that's in a medical office. I think more and more technology is helping to connect providers to other providers that are taking care of the same patient to increase coordination, connecting providers to patients in terms of communication. We're seeing video visits, e-visits. We're seeing remote monitoring of patients. So, you know, the Fitbit that's monitoring your health activity, but there's similar devices to manage or monitor your let's say, your blood sugar levels so that the doctor immediately knows.
On your smartphone now, right?
Yeah. So it's amazing. I think technology is going to have a profound impact on medicine in the future.
What do you think these things are going to have? What impact will they have on patients?
Yeah. That's a good question. So the hope is that all these changes in medicine are making the healthcare system more patient-centered, so more sensitive to them, to make it more open, accessible, to make care more coordinated. I do think that there's also going to be a greater expectation that patients become more engaged in their own care, to be more active in managing their care, and also to be more active in being value conscious. We know with the growth of these high deductible health insurance plans, now patients are actually shopping by price, and that's an expectation of patients now.
A good thing?
I don't know if it's a good thing, but to the extent that it's driving providers to be more efficient and more responsive to the needs and wants of patients, I think that's a good thing.
Are we seeing like less testing? I know that when I do pieces with seniors, one of the things they always complain about is they run too many tests. You know, they're running up my bill, they're running too many tests. Are we seeing less testing now?
I don't know if we're seeing less testing in absolute numbers, but that's one of the potential benefits of electronic medical records that are shared among different providers. So that when you see another provider and you got a test by the previous provider, that provider can easily look it up. And so the hope is that we decrease the duplication of tests over time.
Okay. Open payments. You're going to need to explain them to me.
Open payment was part of the Physician Payment Sunshine Act, which was a provision of the Affordable Care Act. And the basic premise is it's a public transparency program that posts online payments between medical and drug manufacturers and providers, physicians and hospitals. And the reasoning behind this is that if you make these relationships open, it'll reduce inappropriate influence on clinical care, education, and research.
Okay. Where do you see medical care going over the next 5 to 10 years? It's changed drastically over the last 10 years.
Yeah.
Where do you see it going now?
Yeah. So I see what I call greater organization of care. So physicians and providers coming together in larger and larger groups to provide a more continuum of care for patients and care that becomes more coordinated and comprehensive. I see the role of technology growing, and I see us leveraging all this new data that we're collecting.
Do you think we're on the right track?
I'm optimistic that we're on the right track.
What do you mean by that? Do you see pitfalls?
Well, I think there's pitfalls in everything. A lot of the things that people are excited about are simply tools. Electronic medical records are tools that help physician practice in hospitals perform better. But if you don't redesign the system to take advantage of those tools, then you're going to be duplicating errors. And we know that they're not a panacea, and so I think we're still learning exactly what works and what doesn't work in medicine.
Mm-hmm. Has the Affordable Care Act been a good thing as far as helping to move medicine along so far?
I think, in my view, it's unquestionably been a good thing. I think both the expansion of insurance coverage was the right thing to do, and I think just as importantly, the efforts to drive the delivery system towards higher value care is very important.
One of the things that we had talked about when we were talking at the urgent care facility was the fact that once you had so many more people insured, you then had so many more people looking for medical care who did not have doctors. Talk to me a little bit about how that has affected medical care in, say, New York and the country.
Well, I think there is this surge of demand once people get insured. We know that when people don't have insurance, they put off a lot of things that they should go to see a doctor for, and especially preventive care. I think over time, though, having these newly insured patients receive medical care will improve the health of the population overall.
What about urban areas and health care in urban areas? That is part of your expertise. Talk to us just a little bit about how that is changing and what needs to be done.
Well, I think before, when I was talking about all the other things that impact healthcare, the transportation, the housing, education, that's all magnified in the urban environment because we're living in such densely packed environment. And you probably know now over half the world lives in cities. And so we really need to figure out, in this environment, when all these sectors come together to impact the health of a population, what are we going to do about it? Because the city itself becomes a key determinant of good health or bad health.
And how so? Because people are unable to get to health care?
No, it's beyond health care. It's housing, it's transportation, it's sanitation, it's education, it's all those other factors. So I'm thinking beyond the healthcare system, everything else that we see around the city also actually has a profound impact on our health. I mean, I guess the simplest example would be something like parks, the availability of places to go outside and exercise. If you don't have that on a regular basis, your ability to have an active and healthy lifestyle is that much lower.
Okay, so how should lawmakers, people who are in charge of putting these things together, how should they be thinking?
I think instead of thinking of healthcare as a silo, as I'm going to think about healthcare, I'm going to think about planning, I'm going to think about transportation and education, I think it's important to think about all these different sectors and their impact on health, and think about health as you're planning those different sectors.
Okay, I'm going to put you on the spot here at this
Sure.
point. If you had your way, how would you change health care in this country now? What would you do?
So one of the fundamental problems, I think, in healthcare is what I call fragmentation. There's fragmentation at the policy level, fragmentation at the payer level, and at the provider level. At the policy level, the federal and state governments have different roles. There are multiple agencies within a government that regulates healthcare. At the payer level, there's thousands of health plans, and we know already that providers are not connected to each other. So I would try to move towards greater organization or defragmentation of this. And I don't want to be more specific at this point.
Okay. We talked a bit about how this is affecting people across the country. What about the urban environment? Are there particular challenges there?
Well, I think in the urban environment, the thing that we need to consider is the healthcare delivery system is such a small part of what impacts overall health. All these other sectors, transportation, housing, the environment, they have, and socioeconomic factors, have as much or even more of an impact on health. And that's exacerbated in the urban environment because the environment is so dense.
What else is important that we think about when it comes to improving health?
Well, what the healthcare delivery system does is such a small part of what impacts health. The other things, socioeconomic status, the built environment, transportation, housing, education, all those things have as great or even greater impact on health. So I think that moving forward, it's important to bridge the healthcare delivery system and all these other sectors that impact health so we can have a unified strategy to improve population health.
Okay, great. Thank you. Yeah. Okay, that's going to do it for this edition of Talking Health. I want to thank our guest, Dr. Tony Shih, for offering his insight into the rapid changes that are taking place in the field of medicine and how the changes are going to affect all of us. Tony, thank you.
Thank you.
Okay, I'm Mike Gilliam, and we'll see you next time on Talking Health.
This broadcast has been brought to you through a grant from the Commonwealth Fund.